Good morning. I'm Brad Avery, Mayor of Newport Beach, and I'm here with Dr. Martin Fee from Hoag Hospital, and we're very fortunate to have him answer some questions about the experience that Hoag has gone through this past year, and also answer some questions about the vaccine and our community's concerns related to COVID. Dr. Fee, as Vice President and Chief Clinical Officer of Hoag Hospital, provides direction and operational oversight of Hoag's strategic IT innovations, clinical processes, and the patient continuum of care. He also provides oversight of clinical operations for the Hoag Medical Group. Dr. Fee is a native of Sioux City, Iowa, and received his MD degree with honors from University of Chicago, Pritzker School of Medicine in 1988. He completed his internal residency at the University of Chicago Medical Center and completed his infectious disease fellowship at USC LA County Medical Center. Dr. Fee has been a practicing infectious disease specialist at Hoag since 1994. Dr. Fee has served in several other leadership roles at Hoag, including Chairman of Infection Control, Chair of the Department of Medicine, member of the Hoag Board of Directors, Chief Medical Information Officer, Chief of Staff, and Chief Clinical Care and Transformation Officer. Dr. Fee and his wife, Dr. Janice Lee, OB-GYN, have 2 adult children, a daughter who is an OB-GYN resident, and a son who is an environmental engineer. Dr. Fee, welcome and thank you for coming.
Thank you for having me. It's an honor. Thank you.
Thank you, Dr. Fee, for taking the time to meet with us today, and our community really is appreciative of your time today.
It's my pleasure. I'm really honored to be here. It's great.
And I believe I speak for all Newport residents when I say we are all grateful that Hoag is our neighbor, especially in times like these. And I'd like to start by asking questions about how Hoag has been doing, and then discuss vaccines.
Okay.
We've all been through an incredible year that has challenged us on so many levels. What has it been like for you in your leadership role at a great hospital where a contagion is literally coming at you? And how is the Hoag team holding up?
You know, it's been just like for everyone else, it's been a constant journey and a constant evolution. I think what people have experienced in their own life and their own careers and workplaces is similar to what we have, other than it's everyone's looking to us because we're actually healthcare, but things happen very quickly. So initially, you know, we didn't know how big it was going to be. We made preparations for the worst. You all recall this is past spring. We all hunkered down, got ready, had, you know, all the PPE we needed, all the ventilators we needed, did everything we needed to do. You know, cost a lot of resources, and we, you know, canceled elective surgeries and did all these things like most of the hospitals did, and got ready, and then nothing much happened, right? And so it was a little bit of a letdown. It was scramble and then hurry up and wait, and then, you know, which we were grateful for, but then we were like, you know, okay, is this a little bit overblown or what? And then of course the shelter-at-home orders were lifted, and we're now looking at, you know, Memorial Day weekend, and suddenly everyone's out and about and back to their lives, and bam, we got you know, we got hit with a surge then, and, you know, sort of late June, early July. And I think at Hoag, between our 2 campuses, our Newport and Irvine campuses, we had like 70 COVID patients, which we thought was, you know, a lot. But you know, we did fine. We had plenty of resources. We got through it. We had to, you know, learn our processes, and we did. You know, it was a bit of a struggle, a bit of a challenge, but I think we did quite well. And then things settled down, and through the fall, you know, in general, Californians, including people in Orange County, were pretty good about wearing their masks, social distancing, doing everything, and there was very little COVID. And I think we all probably, you know, got a little complacent, and then Thanksgiving hit, and Christmas hit, and you know, it became a whole different story. And I think everyone knows, you saw the paper, you know, in the papers and, you know, online, of course, all the stories from Los Angeles. Orange County wasn't quite as bad as Los Angeles, but we saw COVID like we'd never seen before. It was a real challenge. at our height, I think January 8th, between our two campuses, we had 220 COVID patients in the hospital. So when we thought 70 was a lot, you know, we're now doing 220. And that's where, you know, to kind of answer your question about, you know, how we're all holding up, I think during the whole prior year up until that point, I think it was more of trying to anticipate what was happening, and it was, you know, anxiety provoking and disconcerting and whatnot. But, you know, we were able to hold it together because it really wasn't as bad as we thought. But come December and January, it got as bad as we thought. And I think the great thing is that because we had prepared so well, we were able to do well. We never had to turn away patients. We were always able to flex. We had to, of course, cancel elective surgeries, which I know was disappointing to a lot of people in the community. We had complaints from people who've been waiting a long time for important surgeries who had to be postponed and things like that, but we were able to get through it. You know, everyone rallied, nurses, doctors, pharmacists, respiratory therapists, to do extra shifts. Myself, I do mostly administrative work, as you mentioned in the bio, but I stopped doing all that and went and just took care of COVID patients. There was a lot of my fellow physicians who were more office-based, who also turned their office practice over to others and came into the hospital to help out because we really needed the manpower and woman power to actually care for the patients. So there was a lot of resilience. I think the thing that helped the most for us was getting the vaccination. I think psychologically it came just at the nick of time because, you know, we had enough PPE and we had enough, that's personal protective equipment, for those who don't know the acronym, all the gowns and masks and such. We had enough ventilators, we had enough oxygen, we had enough everything, but you start running out of, you know, people power. And so having the vaccinations, I think really helped us feel like, you know, we weren't ourselves at such personal risk, and, you know, we're going to be able to take care of it. So we got through, and, you know, it's still busy, but I think last I looked, we were probably, you know, 85, 90 patients at the hospital, which, you know, is more than what we thought was a lot in June, but but it's a lot less than it was. So anyway, so we're holding up fine. It got a little crazy there for a while, but I think we did well, and we're able to serve our community and never had to turn people away and never had people in the hallways and, you know, that sort of thing. So
thank you. So during that period from the spike in July to what we just went through in January, what did Hoag learn in terms of treating COVID patients?
Well, I think, you know, as I mentioned earlier, this whole COVID has been a learning experience for everyone, but of course in healthcare we have to learn the most because we're actually taking care of the patients. So Hoag really has been on the forefront with a lot of the research protocols. So early on, when we still continue to participate in a lot of these research studies looking at different medications, convalescent plasma, antibodies, all those things, because of course there was no COVID, you know, a year and a half ago, so these things are all being developed very rapidly, including the vaccines, which I know we're going to talk about. You know, early on, the patients were, we treated patients, I don't just mean we, Hoag, all of the medical community in the world treated these patients like a more typical pneumonia patient, put them on ventilators, do this, do that, and the patients didn't do well. And what we learned is that for various reasons, patients with COVID, if you put them on a ventilator, they do poorly. So it's interesting because one of the metrics, if you will, early on is, do we have enough ventilators? Do we have enough ventilators? And in reality, we want to keep people off. I mean, some people you have no choice, you have to put them on a ventilator. But if people are on the borderline, if we can keep them off the ventilators with high flow oxygen through their nose, they do better. One of the things we also learned is with COVID is that it causes a hypercoagulable state, so people get blood clots. So we learned to give everyone anticoagulation. And then with medications, you know, of course there was initial, you know, I wouldn't even say there's studies, but speculation that, you know, that medications like hydroxychloroquine could help, but those studies didn't pan out. But then we were looking at the antiviral drug remdesivir, which had been used, I think, for Ebola and some other viruses. And so Hoag was part of those studies, and the patients who got remdesivir did better. So that became, it went from being experimental to emergency use to sort of standard of care. And so by the time December and January surge came up, everyone's getting remdesivir. Steroids too, dexamethasone, which is a common medication used, it's an anti-inflammatory. That was one that there was an English study showed that significantly decreased mortality. So most patients who were ill enough to get hospitalized requiring oxygen, we learned to give them anticoagulation, give them dexamethasone, give them remdesivir. The other thing we found is they call it proning, laying people on their stomach, interestingly helps. So all these poor patients are having to lay on their stomachs with oxygen, so it's not the most comfortable, but they do better. So by a year later, less than a year, 9-10 months later, our mortality's gone down. So even though we're admitting a lot more patients, the death rate's gone down just because we've learned better how to care for these patients.
Right. So what about, I know hospital workers, have there been difficulties with, tell me about any hesitation on the part of the hospital workers to the vaccine? Has there been any real issue with that?
I think no. I mean, I thought you were going to ask a hesitation to take care of COVID patients. I said, yeah, there's been a little of that, but people got over that. But initially it was, people were quite frightened, but over time they got over that. But yeah, no, I think that really, I really saw a change in the morale of the health of the frontline healthcare workers when that vaccine came out, because even though we know we're well protected, we always had the personal protective equipment we needed. We never ran out. We always had everything we needed. It's fatiguing. It's almost like you become numb to it of, putting on the mask, putting on the gown, putting on the gloves every time you go in and out of a room. And over time, there's the potential to get a little careless, or, not on purpose. You're just like doing it. You forget to put on, I mean, I've done it, I forget to put on, my goggles or whatever, right? I go in there like, whoops, I forgot my goggles or whatever, right? And so those things happen. And I think, everyone's just, when you take care of that many COVID patients every day, people get worried about their own, their own personal protection stuff. So I think having and then also knowing that, most of the healthcare workers that I've seen at Hoag who've gotten COVID have gotten it at home from, their college-age kids who went out and come in, right, exactly. So they didn't get it at work, but nevertheless, that still takes them out, and that's the point. It doesn't really matter whether you get it at work or you get it at home. If you're suddenly out of the mix, that's, when we need more and more people to take care of the patients, we can't afford to have people out with COVID, right? So again, I think having the vaccine, so yeah, there's a few people, I would say, I mean, I want to say that Hoag vaccinated 97% of its frontline healthcare workers.
That's what I was wondering.
Yeah, so 97%. Now, there's other employees that work in other areas that aren't quite frontline, who are like, like, maybe I'll wait and see, and I mean, and there's always certain people that are a little skittish of vaccines for whatever reasons, but no, the people who are actually taking care of COVID patients took the vaccine. I can tell you that. So,
yeah, it's an interesting thought that that we've underestimated this level of stress that society's under because of what you were talking about when people are exposed, and there's so many questions, and I don't think people acknowledge it. They're feeling it, but they don't acknowledge it. And we see that sort of show up in different ways in society. Anger and people, speeding on the road or whatever they're doing.
Well, it's just the social isolation too. You can't do all the things. It's the one thing of the unknown, and the other thing, it's like your whole life's been turned upside down, right? You can't go to a ball game. You can't. You can't go to a movie, you can't go out to dinner, you can't see your elderly parent, whatever it is. I mean, your whole life's been turned upside down, and there's no answers to your questions, right? It's really tough on the mental health of the society, for sure.
And I can imagine for those on the front lines, who earlier hadn't been vaccinated, just to the sheer number of people that are coming in with COVID, and you've got your PPE, but it's still has to be.
Well, and people are, a lot of the healthcare workers, especially the nurses, are young and they've got kids at home and they're worried about, I don't want to bring this home to my family, you know, so it's not even their own personal health they're worried about, but, am I going to bring this home to my family and all that sort of thing. So
sort of thoughts that come to people at 2 in the morning and wake them up.
Exactly. Exactly. So
I've got a few questions about the vaccine.
Yeah, let's do it.
How long do you think COVID-19 will be with us as it mutates and new vaccines are developed?
Well, if I knew the answer for that, I'll speculate. This is pure speculation. Okay. I'll say that the vaccines are continuing to roll out, so I'm optimistic. It's taking a little longer than we'd like, but I also point out that the fact that we were confronted with a new pandemic virus that we'd never seen before, and we've got a vaccine. We've got several vaccines, 2 that are already available, that are effective in less than a year is kind of nothing short of a miracle, right? So the fact that we don't instantly have 1 billion doses for everyone to get instantly, I mean, again, it's kind of like setting expectations, in some ways, let's be grateful we have it. And, it's hard. I think what's hard is when you see other people get it and you can't, right? And then that causes a lot of stress and anxiety, right? But I think, I'm digressing on the vaccine supply issue, but I know we're going to talk about that. But I think over time, there's nothing, we'll just keep cranking them out. There's new vaccines coming. So yeah, it may take, I'm guessing it'll take most of 2021 to get everyone vaccinated. And then to your point about, that's why it's important to try to get people vaccinated, because the longer the virus circulates, the more it can mutate. And these mutations are subtle, I mean, I always say, good news doesn't sell, right? So, right. So, and I fault the media for that, because I feel like, they're constantly putting out, the negative headline and then the positive ones, like they're, it's like giant headlines, COVID increasing, and then it's like, small headlines, COVID continues to drop by, 30, 40%, whatever, so same thing, the mutations, right? So yes, there are mutations, viruses mutate, that's what viruses do. The mutations are subtle. From the data I've seen, they don't negate the vaccines, but perhaps the vaccines are not quite as effective. So yeah, maybe we need some additional doses or something like that. So we got to stay ahead of it. But I don't feel like so far the mutations that have come up are going to be like, the vaccines aren't going to work at all type thing. They may be slightly less effective. And a lot of it really depends on how many people get vaccinated. I mean, in some ways I'm encouraged that so many people want it, because I have a fear that there's a large subsection of the population that doesn't trust vaccines, won't get it, and so they'll constantly be this source of COVID that won't go away, right? So I'm less concerned about mutations and more concerned about people not getting vaccinated at all and being this constant reservoir of illness, of infection for it to come from, right? So
yeah. So for people over 65. We're seeing it seems to be moving better in Orange County, and the supply, I don't know if it's increasing, but we seem to be vaccinating more people.
It's getting there, yeah. I think I looked at the latest statistics. I think, and again, this is my perspective of like, hey, the fact that we have a vaccine at all is pretty incredible. And yeah, it's hard to just instantly come up with a complex vaccine distribution process and such. But yes, I think it's getting better every day, I think. I think right now I looked in Orange County, so our population in Orange County I think is 3.1 million, give or take. And so far we in Orange County have given, I think, 313,000 vaccines. But remember, they haven't figured out yet, is that first and second doses, right? So if it's, say it's maybe 250,000 residents of Orange County that have received at least a first dose, and many have, healthcare workers and such have received a second dose. So that's what's the math on that? 8-9% of the population, something like that. So that's getting there, right? I mean, we got a long way to go, but yes, to your answer, the vaccine supply keeps coming, and that's really what's, it's not. yeah, we could be more efficient. You know, the website, yeah, it crashes and things like that. But it's really an issue of the vaccine supply, right? And we don't have control over that. We just have to wait. The federal government is, pushing, Pfizer and Moderna, Johnson & Johnson. I think people know there's a new one-shot vaccine coming out, or it's by Janssen, which is a subsidiary of Johnson & Johnson. But that one hopefully may be FDA approved by the end of the month, right? And so the supply will get there. We'll get there. So. And
over time, just as even this group, it starts compounding in terms of less infection.
Correct. Exactly. Right. It's like you get to that so-called herd immunity, which we don't really know what that number is, but it's more than what we've got so far. Right.
But even with this number that we have out there, it's compounding. It's,
exactly.
Fewer people are getting infected.
Exactly. Remember, many people have already been infected, and being infected gives you some immunity at least for 3 months or more. Right. It doesn't. People have gotten reinfected with COVID, but still. So you've got whatever, maybe 10% of the population that's gotten infected, and then another 10% that's gotten vaccinated. So we're getting to some real numbers of protection within the community that I think will help continue to keep the virus smoldering at a low level.
Right.
I was going to mention during that interval between our two surges, what turned out to be the baby surge, the baby surge in June.
The first act.
Yeah, the first act, Act 1. Well, Act 1 was zero; it never happened. Right. We were too efficient. Act 2, Surge 1 was like nothing, just like a few patients. Surge 2 was actually a surge, and we thought, wow. And then this last one was the real one, and hopefully the last. Or the last big one. But in between the second and third, the June, July, and the December, January, we still always had COVID patients in the hospital at Hoag. Like, I think the lowest we ever got to is like maybe 9 or 10 patients. So it never went to zero, right? So it never went away. It just was kind of smoldering at this low level, and then took off. So
when the county starts decentralizing its vaccination program, what will Hoag's role be in vaccinating members of the public?
So interestingly, they already have what happened is they decentralized initially, and then they pulled back, and so we've already got our infrastructure in place. The original thought was we've got to get the healthcare workers, which is right, because if we don't have people to take care of COVID patients, we're in big trouble, right? So the initial was send out all the vaccines to the healthcare system. So, Hoag got a big batch, all the hospitals, St. Joe's, Mission, et cetera, Saddleback, Orange Coast, all the hospitals got doses of vaccinations. And those were given primarily to give to their frontline healthcare workers, their other employees, physicians on staff, their staff, et cetera. But then the idea was then, okay, now we're going to have you start vaccinating the community. And that's where it started getting, because they wanted to make sure that, when I say they, really the state of California and the Orange County, the healthcare authorities, state and county, wanted to make sure, with good reason, that people didn't jump the line, right? So that it wasn't like, somebody, whatever, you get vaccinated over,
Dr. Chow was emphatic about that.
Yeah, exactly, right? So then it became very prescriptive. It was like, okay, you have to document, and I'm not being critical, it's because there's a reason for it, right? But it became, okay, you have to document why, and you have to do this, and you have to so many points, and this, and it became so prescriptive that, none of the healthcare systems had and by the way, we're in the middle of a COVID pandemic.
You're in a trench war.
We're in a trench war at the moment that you're trying to come up with some intricate protocol to make sure that we don't give it to the wrong person. If you do, we're going to put you in jail, right? Right? So it's kind of like everyone's
stressor.
Yeah, exactly. Like the doctors, if you give it to the wrong person, they did. The Governor Newsom came out and told the doctors, if you give it to somebody else who you shouldn't give it to, we're going to revoke your license, right? And so then it's like, okay, well, I don't want to get my license revoked, so I'm not going to give it to anybody. So anyway, I think they realized that that just wasn't going to work. So the state of California said, you know what, pull back. Let's do these super centers, Dodger Stadium, Disneyland, Soka University, right? All these big super sites, so we can just get the vaccines out, right? Because we're all coming under criticism, like there's all these vaccines sitting there and no one's giving them.
But political heat was going on.
Yeah, exactly. But that's the background. I mean, you can appreciate it's hard to come up with a complex process to give vaccines to only the right people and not the wrong people. in the middle of a giant pandemic. And so, so to answer your question, the infrastructure is already there. We're already doing it. It's just the county is only releasing very small amounts to the healthcare systems. So, so Hoag is vaccinating the community, and we do have, you can go to the Hoag website, I think it's hoag.org/COVID-vaccine or something like that. You can Google it. But when Hoag gets vaccines, we open up, you know, appointments. Of course, they're gone in like, you know, hours or whatever. Right. But over time, of course, as we get the vaccines, it'll be a more normal process, you know, a more normal process. But right now, the bottom line is we are vaccinating our community based on the supply we get. And right now, our supply is very limited, but we are getting some. So you know, patients, you know, ask, how do I get the vaccine? I say, you know, go to the county's othina.com, try there, and then keep trying on the, you know, for the Hoag patients, keep trying on the Hoag, and just keep looking at. That's all I can do is tell you every day, look at both, and and
I know people doing 3, they do UCI or
UCI, exactly, exactly. Although, exactly. Although I think it would be, I mean, you know, again, it's I get it. If you don't have it, you're going to try everything. I think it would be better to stick with where, you know what I mean?
Right.
If you're a Hoag patient, stick with Hoag. If you're a UCI patient, stick with UCI. Don't like try every, you know, because that's kind of. I mean, we can't stop you from doing it, but it's not the intent, right? If you really want to not go to your own healthcare system, do the Othina and go to Disneyland or so. Assuming you can get an appointment, right? I mean, it's still a little bit of a crapshoot sometimes.
Right. Yeah. There's just people just aren't quite sure, so they're just trying everything they can.
Sure. But they'll get it eventually. That's the good news. It's not like we're not running out, right? It's just a matter of, you know, when will we get it? And again, people are just tired of. All you have to do is just keep sheltering, you know, like you've been doing, but people are, you know, tired of it. But even if you have the vaccine, you still have to be good, right? You know, that's the thing.
Well, it takes some discipline, and it's interesting to me, you know, people have had COVID once. If they get it twice, you've got to think, did they change their behavior in terms of, you know?
Probably not, because they probably thought, oh, I've had it once, I'm immune, right? You know, and then, exactly. So
there have been a lot of questions, obviously, about the vaccine safety, and we've discussed this, but what are the questions, the top 3 questions, if you will, you get from people about if they're questioning safety?
Yeah, I think mostly people are worried about allergic reactions and things like that. I mean, there's always people who are, you know, a little bit out there with, you know, like the government's, you know, injecting you with something so they can track you and things like that. You know,
Bill Gates.
Yeah, exactly. Bill Gates is tracking you, you know, so they can do what, I don't know, but, you know, but anyway. But most people, they're worried if they've heard about severe allergic reactions, right? And I think that, you know, I tell people, look, I haven't seen any, but that doesn't mean they don't exist, but I think it's pretty rare. I think most people just have a more intense immune response than others, right? So like myself, when I got mine, I had a very sore arm, but I otherwise felt fine, right? You know, and that's good. I was happy I had a sore arm. It means that I was developing an immune response. Some people get more ill with a flu-like symptom, and you know, maybe have to take a day off or 2 of work. But I haven't seen anyone, or really seen anyone, that's had like some devastating, you know. I mean, there's always, you know, 1 in a million, you know, people get like Guillain-Barré syndrome where they're paralyzed for a period of time and things like that with you know, even the influenza vaccine. But I don't think there's really been much of any of that I know of. So.
Right. So if a person, what symptoms would exist where people should go to the hospital? So now we're sort of.
Are you talking about like if they have COVID? Or
right. So they're feeling, you know, I think everybody's experienced not feeling well and just going straight to, oh, this could be COVID.
Oh, right,
and so, you know, what are the helpful things that they should remember before deciding to take it to the next step and go to the hospital?
Yeah, well, or maybe 2 pieces. One is, I wouldn't go to the hospital to get COVID tested, right? So if you think you might have COVID, I mean, unless you're like short of breath or something like that. But if you're like, let's say you were, you know, around somebody and you found out they had COVID and now you've got like a stuffy nose and a fever, right? Then yeah, I would go get COVID test. I think the biggest, you know, because I think we've all had that moment. I mean, I have a little bit of allergies, and I can't tell you how many times I've woken up with a stuffy nose or a slightly sore throat, and I'm thinking, oh, well, this is the COVID, right? You know, and I'm like, okay, and then it just goes away, right? You know, so I think, you know, symptoms that persist, certainly fever, cough, persistent nasal congestion, those sort of things. I mean, they give a list of the symptoms, at any COVID. I generally would recommend, either your doctor's offices or urgent cares are generally set up to do this, and they'll give you the list of symptoms to get COVID tested. But yeah, I would say, give it a day to see if it persists and it's not just some mild little allergy or something like that. Once you're tested, if you're positive, then you need to obviously isolate, and then the criteria for going to the hospital would be primarily respiratory if you're getting short of breath, like you're showing, because just fever but you're not short of breath is okay. But if you're having trouble breathing, that's where we worried about the COVID pneumonia, that we have to put you in the hospital and put you on these medications.
And that's when you should go immediately, right?
Yeah, exactly. If you're having difficulty breathing. And they have these things now, actually, it's gotten pretty sophisticated where you can check your pulse ox. So if your pulse ox is on room air is persistently less than 90 and you're not feeling well, whatever, go into the hospital. The other thing too is, and I think you may be asking about that later, but I might as well segue into it, is around these new antibody treatments, right? Because if you're in a high-risk group, over 65 or obese with what they call a BMI more than 35, those are considered the highest risk patients for developing pneumonia if they have COVID. We do have those antibodies, antibody treatments that if you get it, it decreases your risk of going to pneumonia, right? So that's a little nuance that we have now. And actually the Fairview Center that the state's running, they've actually got it available there. Some of the home health agencies have it now. Hoag has it available at our emergency department. I think other organizations do as well. So
that's becoming common.
Yeah. So I would say even if you don't, I guess if you're short of breath, if you got COVID, so the symptoms, you can read about those to get COVID testing at your doctor's office or in urgent care. If you then have COVID, then if you get short of breath or your pulse, you got to pull home pulse ox is less than 90 consistently, go into the emergency room to be evaluated. But then if you're got COVID and you're not that sick, but you're over 65 or you're significantly overweight, then consider getting one of the antibody treatments. That's all evolving of where you can get it, but they're available as well too, to help prevent it, right? Because that's the only thing that's been, a lot of people ask, like, what can I do if I've got COVID? How do I prevent it from going to pneumonia? And they start taking all this stuff, and then it actually makes things worse, right? And the antibodies really are the only ones, but they're reserved right now for high-risk people. So
compared to where we were a year ago, it's amazing.
It's amazing. That's what I'm saying. The fact that
knowledge gained,
exactly,
all the treatments,
the
vaccines, it's extraordinary.
For
all those out there that are have a concern about going to Hoag, not COVID related, but their chances of picking up COVID if they go to Hoag. I mean, this is something I think there's a fear out there. Obviously not just Hoag, but all hospitals. Some people just have it not to go.
I think that's, well, so here's where I think certainly there's no risk of going to, well, on purpose we limit visitors to the hospital just so we don't have a lot of people around that could bring COVID in. You're not going to get, I guarantee you're not going to get COVID from a COVID patient that's hospitalized. I think some of the concern may be the emergency department, right? Where we don't know if somebody's got COVID, you're around a lot of other people and things like that. But, I think you have to put things in perspective, right? COVID probably only makes, it also depends on your age and such, but for most people, COVID doesn't do much, right? It's a small, maybe 1% that get ill enough to get hospitalized or something like that, depending on your age and your risk factors and things like that. And so, so maybe there's, I mean, initially they were looking at, the mortality rate's 2 or 3%, but that was of people that were tested, and the only people who were being tested were people who were really sick, right? So if you test everybody, it's really closer to probably, 1% across the entire population, which it would be much higher, obviously, for a 90-year-old than a 20-year-old. But your personal risk of COVID is low, of developing, dying of COVID is low, even if you have COVID. But it's enough people get it that and it's contagious enough that it kind of overwhelms the healthcare system. That's really what it's all, what it's always been about. It's more of a public health issue than a personal risk. And so if you've got a significant problem, and you ignore it, you're much more likely to have a bad outcome from that than
Yes.
you might get COVID. You might get COVID, and then you might get sick from the COVID that you get, right? I mean, so it's you know, people take risks every day. You get on the freeway, you don't think about, well, this could be the day the truck kills me, right? You know,
right.
I mean, so,
Yes.
right? You know, you just don't think of statistics, right?
Yes.
It's statistics, right? So, so you get on the freeway and you don't think about your risk of dying in a car accident, but it's there, right? And so it's the same thing. People, because COVID is so in front of us in the media and everywhere, people have a incorrect view
Yes.
of risk related to COVID, right? And so that's the thing. So to answer your question, if you have an issue, first of all, if you are going to the hospital to visit a loved one who's very ill for whatever reason, you do not have to worry about getting COVID, I guarantee you that. If you are ill with an issue that needs to go to the emergency department, if you're sick enough that you think I need to go to the emergency department, you go. Because that problem is more likely to get you than, oh, I might be in contact with somebody who might have COVID, and then I might get COVID, and then I might get really sick from COVID, right? On the other hand, I could die of my heart attack right now that I'm like worried about not going and getting COVID, right? You know, so
yeah.
yeah.
So for the people who've had COVID, and obviously there's a bunch of people who've had COVID that probably aren't aware of it,
Right.
and or had mild symptoms and never really, just stayed home a few days, and they go get the vaccine, they might have a stronger reaction.
Yeah, they may.
And then should they get a second vaccine and go in for the second tranche of vaccine?
Yes, the answer is yes. We still recommend, even if somebody has had COVID, we still recommend that they get the COVID vaccination. The reason is because the vaccine acts differently than the natural infection, so it's kind of both and, right? So and we know people who've had actual COVID can get reinfected. So we recommend vaccinating them just like anybody else. First dose, second dose. Well, assuming you get right now all we've got are 2-dose options, the Pfizer and the Moderna.
Yes.
The new Johnson & Johnson / Janssen is single dose, which, it may not be quite as effective, but it's effective enough, and it's one shot. So it's really got a lot of appeal to it.
Yeah.
So,
great, thank you.
but it's not available quite yet. So.
Right. For my final question, I just wanted to get your personal opinion or just your thoughts.
Okay.
Do you think the world will go another century before another pandemic, a global pandemic?
No, I think we were lucky. I mean, if you're a student of history and you study humanity, pandemics is part of the human condition, right? I mean, if you look prior to 1918, our ancestors, whole families died of diphtheria and cholera, and then of course you go back farther in time, the plague, wipes out, a third of the population of Europe, and there's always, the troops die of dysentery and typhus and typhoid fever, and so all these, these sort of illnesses that have been part of humanity. I think when we developed antibiotics, ones that are bacterial sort of went away, right? And so that's part of it, right? Because a lot of the ones I mentioned were bacterial. Now we have antibiotics and stuff. But antivirals are more challenging, and I think honestly that we've been lucky as the human race that it took 100 years before we had another one. So again, I'm speculating, but I think it was, based on prior history, I think we were, lucky that it's been 100 years between major pandemics, and not to paint doom and gloom, but I just think we just have to be I think diligent and think about that and how we live our lives and such.
And work on preparedness.
Exactly. So,
but in terms of human beings, just by virtue of expanding into areas that they haven't been before. They're coming more in contact with animals.
Yep.
Particularly in certain countries.
Yep.
And that's another piece of the puzzle.
Yeah. Well, and just and people circulate around the world now, right? Used to be you never left your little village, but now you're going around.
It's incredible how fast it travels.
Yeah. Yeah. So now it's like it doesn't. Something that would have been, things become pandemics that would have just been a local outbreak in a local village, right?
Right.
But now, you've got tourists traveling there, going here, and it just spreads like wildfire. So that's part of the reason. One is, yes, we're venturing into, into the wilderness, if you will, and coming exposure with these things. But then on top of it, prior viruses and such that would have been isolated
yeah.
to that village or that community because everyone lived and died in that community. They're going to the local big city where other people are traveling, and pretty soon it just goes, right?
Right. Right.
Yeah. So I think we got lucky. It's been 100 years between, but we'll see. Hopefully not. Hopefully I'm wrong, but
yes,
we'll see.
hopefully.
Yeah.
Dr. Fee, our many thanks to you and everyone at Hoag Hospital for always being there for the Newport community. Thank you for your time.
You bet. My pleasure. We're honored. Thank you so much.